Today I present an evaluation of brachial plexus blockade versus non-regional anaesthesia for wrist fracture surgery, a systematic review and meta-analysis. Wrist fractures present an increasing burden on the healthcare system due to an ageing population and increased activity levels in older adults. Persistent post-surgical pain occurs in around 48% of orthopaedic patients at 3 months, and the prevalence of this can be as high as 65% for fracture-related surgery. The most severe form of persistent post-surgical pain, known as complex regional pain syndrome, has an estimated incidence of 26.2 per 100,000, with the upper extremity being more frequently affected. In addition, 15% of risk factor patients have a progressive clinically important functional decline at 3 years post-fracture. A brachial plexus block pre-incision may attenuate peripheral nociceptor activation through sodium channel blockade. This can prevent central sensitization by reducing excitatory neurotransmitter release and hence reduce persistent post-surgical pain and in turn improve functional outcomes compared with systemic analgesia or local infiltration. In order to establish the evidence base, we did a literature search of all major databases, looking at studies between 2003 and 2026 to reflect contemporary anaesthetic practice. All RCTs were eligible for inclusion if they compared brachial plexus block alone with a non-regional anaesthesia technique in adult patients undergoing surgery for wrist fracture. Studies needed to report at least one pain or functional outcome. Brachial plexus blockade provided superior early post-operative analgesia with significantly lower pain scores at 2 hours post-operatively. However, the benefit was not sustained, with no significant differences at the longer time points: 4 hours, 24 hours, 48 hours, 72 hours, 2 weeks and 6 months. Only one functional outcome, the patient-rated wrist evaluation scale, was reported twice, allowing meta-analysis. This showed no significant difference at 6 months. In total, 5 randomized control trials were included in the meta-analysis. However, the overall certainty of evidence was graded to be low. Brachial plexus blocks provide superior early post-operative analgesia, but there is no evidence that this translates into improved chronic pain and functional recovery outcomes. The current evidence base is limited by small, heterogeneous studies, predominantly reporting short-term outcomes. Future research needs to focus on standardized, patient-centered core outcome sets, longer-term follow-up, and in order to determine whether early analgesic benefits from regional anaesthesia result in meaningful improvements in recovery.